before the 30s of the 20th century. There were no shelters provided for the mentally ill patients. Some of the treatment methods used: reading the Holy Quran, ironing treatment small section behind the head, isolation and imprisonment at their homes, sorcery, incantations, and magic spells to drive out entities and demons, severely beating the patient to drive out demons, placing iron necklaces on the neck and on the foot of the patient. Some of the beliefs that the reason to be mentally ill was beating up children, or falling in the bathroom at night, and after delivery for females. They used incantations and reading the palms to determine the presence of mental illness in a person. The establishment of a home for the mentally ill patients in 1930. It was a small home in Manama, in Faraj al-Hammam. It was called Dar al-Majanin, Home of the Insane. It had 12 male patients, 2 female patients, and consisted of 3 rooms. In that home, patients have suffered from crowdedness, high climate temperatures, and feelings of discomfort of the home. In 1937, all the patients who were in the Home of Insane have been transferred to the current-day existing hospital in Kaful area, which was called Insane Asylum. In this new building, the patients were assessed and followed up by a doctor on a weekly basis. In 1948, the hospital administration relocated from the Manama Municipality building to the Medical Directorate, as it was refurnished, and appointed an Asian nurse specialized in mental illness. The beds have been increased and the food was improved. The patients were encouraged to spend their time out of the ward in the daytime, and engaged them in activities like planting and caring for domestic animals. In 1949, a new section was built, and utilized as a laundry section to wash patients' cloths. In 1950, 2 rooms were built to encompass 30 patients. The rooms were similar to prisons. Each room had an iron bar door, which was locked with bolts from the outside and an iron lock as well. The rooms had small windows. In 1957, a document that was released by the government showed a high standard of diagnosing the mentally ill according to the standards of that time. The previous beliefs of sorcery have faded away from the public due to increased awareness, education and the development of healthcare. In 1963, there were 270 patients, following up an increase to 2,990 by the year 1960. In 1963, the bed capacity has increased to 120. In 1964, the first outpatient department (OPD) was established by the supervision of the British Dr. Butler, with the assistance of the Egyptian Dr. Saad Aziz. ECT was given without sedation, and a treatment of insulin shock was done in those times. In 1967, a new administrator had been appointed in the hospital, Dr. Imad Eddin Farid, who was the first Arab doctor specialized in psychiatric illness. His main achievements were: abolished the prison rooms, changed the hospital name to the Mental and Psychiatric Hospital, established an outpatient facility in SMC, demolished all the walls that separated the prison rooms, and formed 4 new wards, each encompasses 10 beds. In 1969, the first social worker Ruqayya Amiri was recruited. Establishment of occupation therapy department at the expense of Haji Isa Al-Zira. Increased in the numbers of Arab psychiatric doctors, social workers, and staff nurses. In 1972, Dr. Jen Safar was appointed in the hospital, as the first Bahraini specialized in psychiatric illnesses. In the year of 1973, Mrs. Layla Mourad, who was the first Bahraini nurse, had specialization in psychiatric nursing from UK. She rendered her services as a psychiatric nurse at the psychiatric hospital. New drugs were introduced to treating psychiatry illness, and insulin shock therapy was obsolete. ECT was given after placing the patient on anesthesia, which all combined resulted in better health for the patients and speedy recovery. In 1975, a new specialized department was established to treat psychiatric illnesses in children and adolescents. In 1979, community department was established. A program was introduced to teach Arabic language to foreign staff nurses to reduce language barriers between them and the patients. In 1979, Ibn Nafi's unit was established with 88 beds to target patients with chronic psychiatric illnesses. In 1979, a psychiatric care unit was opened in SMC with 2 wards, one for males, and the other for females, with a bed capacity of 48 in the whole unit. A mosque was built for the psychiatric hospital by the expense of the Kuwaiti Mr. Shaikan Al-Farizi. In 1983, a new kitchen for catering was opened. The completion of building the OPD building, which included the pharmacy, the lecture hall, administration offices, and a library. In 1985, the hospital name was changed to the Psychiatric Hospital. In 1988, the hospital was acknowledged as a learning centre for the first part of the fellowship certificate in the Royal British College. The hospital was acknowledged as a learning and training centre, which is recognised by advanced learning institutions in the UK and Ireland. The hospital was acknowledged by the Arab Medical Specialties Board as a learning and training centre. 30 doctors are working in the hospital. At present, we have the total number of nursing personnel working in the psychiatric hospital about 301. The hospital encompasses 201 beds. Development is still continuing to develop other branches of psychiatric health care.